Vitamin D is a fat-soluble vitamin that is essential in maintaining homeostasis in the body and a molecular level that aids in the metabolism of calcium, magnesium, and phosphate for bone growth. Vitamin D is unique to other vitamins because it can be produced through the skin endogenously when exposed to sunlight. The majority of vitamin D is absorbed through the skin, contain vitamin D, or fortified with it. On a smaller scale, vitamin D can be consumed through foods such as fatty fish, eggs, mushrooms, and fortified foods like milk and orange juice. Through recent data, it has been suggested that since vitamin D is a fat-soluble vitamin, that when there is an increase in BMI, there is a decline in vitamin D in adipose tissue. A deficiency in this vitamin has been correlated to visceral adiposity, and in turn could be a biomarker that is related to visceral adiposity-related dysmetabolic states that include cardiovascular disease, type 2 diabetes, dyslipidemia, and atrial hypertension. For this population, it seems as though weight loss is the best way to help improve vitamin D concentrations. The adipocyte hormone leptin aids in decreasing food intake as well as body weight. The resistance to leptin on a cellular level is correlated to obesity. Many factors can interfere with the ability for the body to convert vitamin D from the skin, such as time of day, season, latitude, clothing, skin pigmentation, and age. The main cause of vitamin D deficiency is an insufficient amount of sun exposure. An impaired ability to absorb and use vitamin D in the body, along with an inadequate diet and increased excretion, could result in a decline of vitamin D concentrations in the blood. When it comes to dietary intake, it is recommended that people ages 1 to 70 consumed 600 international units a day. There are various health risks when it comes to night shift work among healthcare workers and obesity and other metabolic pathologies. Due to the nature of their work and the interrupted sleep during daylight hours can also contribute to the metabolic disturbances. Shift night workers are at greater risk for developing a vitamin D deficiency as well as obesity. It has also been shown that night shift workers tend to eat irregular meals, including more snacks that could contribute to vitamin D deficiency. Based on a meta-analysis, there is a direct correlation with larger waist circumference and deficiency in vitamin D. A study conducted among young hospital workers with a rotating day and night shift were still at high risk of vitamin D deficiency. Deficiency in this vitamin can cause issues in the future when it comes to overall bone health, such as osteoporosis and bone fractures. Supplementation of this vitamin could aid in weight loss. Based on a 6-week double-blind study conducted among females ages 20 to 40 who are obese and overweight, with vitamin D supplementation, their BMI, waist circumference, and weight improved. Vitamin D supplementation during weight loss approaches have been shown to be protective of bone health. Those who are physically active tend to spend more time outside and are exposed to UV radiation more often. Weight loss is based on multiple factors, and one could be maintaining adequate levels of vitamin D.